Influence of marriage and family on health and health practices. So, introduction. Through communication, every family member can influence another family member's health, attitudes, and behavior. Conflict among spouses can affect physical health. So, through communication. So, communication, as we already know, the process of transferring the messages from one person to another. So, it can be verbal and non-verbal. So, in every family member can influence another health family member's health. So the way you communicate with other family members or other people, it can also affect other health attitudes and behavior. So if you have a bad communication with other person within the family group, then that person health attitude and behavior can change. And if there is any conflict among the spouses, that can also affect physical health. As we already know that in psychology, we studied about the body and mind relationship, and then how the mind affect the body and the body affect the mind. So all these things can happen through communication. Now let's see the health benefits of marriage. Health benefits of marriage. The first one is social support. Social support is important. And the second one is greater happiness and life satisfaction. So through marriage, there will be greater happiness and life satisfaction. Satisfaction of the life. And protect social isolation. Protect social isolation. So if the person is uh, isolated before marriage and after marriage, it can the person can be more social, more participate in social. He can be protected from social isolation. And it promote health. Marriage also promote health. These are the health benefits of marriage. Next is the positive aspects. So there are positive and negative aspects. For positive aspects, the first one is social support. It decrease social support and also it decrease the onset of chronic illness. Social integration also reduce the mortality risk. Social support. The first one, social support. That is one positive aspect of marriage, and it also decreases the onset of chronic illness, and social integration will reduce the mortality rates. And the next is negative aspects. Negative aspects is of marriage is not all the family relation will have a good, not all family relation will uh, not have a good impact on health in the marriage. And here the role of gender may also have negative impact on women health. Role of gender, like the women will be restricted for some extent there in any kind of situation, and this is one of the negative aspect of role of gender. So the influence of marriage and family on health and health practices. We have seen the introduction, the health benefits of marriage, positive and negative aspects. Now we will talk about the next topic, which is illness and family. Illness and family. So mainly what happens is that eh, when family members got sick or fall, the other also family members also get worried. And in the family members mainly, the other family members mainly help the person who is suffering from illness through financially and psychologically. So mainly in case of children, old people and pregnant women, mainly the role of family is very important. Influence of marriage on health and health practices. Here many children, pregnant mother, old age, mainly play important role. Okay. And next is the influence of marriage on health. The first one is income. The second one is spouse. The third one is satisfaction. So the first one is income. So higher income will help to prevent stress. Stress. It will decrease the stress. And spouse mainly monitoring uh, good eating habits, regular exercise, all these things are important. So healthy habits. So healthy habits should be encouraged, like eating healthy diet, exercises. All these things are important uh, for the health, and so if if a spouse is engaging in unhealthy activities like smoking or heavy drinking, then it can also affect the health. It can also affect the health. Then satisfaction. Satisfaction. Talking about the satisfaction, it should be fulfilling, fulfilling emotional needs. Fulfilling emotional needs, and also intimate relationship. All these things will come. So this will affect the both the mental and physical health. So influence of marriage on health, income, higher income will also decrease the stress, and the second one is the spouse. Mainly, the spouse should engage in healthy habits like eating well balanced diet, exercise daily, and the spouse should not engage in unhealthy activities like smoking and heavy drinking. Otherwise, it will affect the health of the other family members also. And the satisfaction, when it comes to satisfaction, fulfilling emotional needs and intimate relationship also will affect the mental and physical health. So a good intimate relationship and will have a good physical and mental health. And fulfilling the emotional needs is also will boost the physical and mental health. So these are the points which influence on the of marriage on health. The next is effect on health behavior. So how does the marriage affect on health behavior? Let's see effects on health behavior. The first one is alcohol consumption, drugs, alcohol consumption, drugs use, cigarette smoking, cigarette smoking. These all affect on health behavior. And marriage reduce drinking and drinking, alcohol consumption, all these drugs, all these things will be reduced with after marriage. So if a person is involved in unhealthy habits or unhealthy lifestyle habits like super heavy drinking, smoking, then after marriage, the person can also reduce all these unhealthy habits. The person may reduce the drinking habit or smoking habits. Next is effect on mental health. Mental health. How does it affect the mental health? So marriage reduce the depression, anxiety, marriage reduces the depressive symptoms for both men and women. So getting divorced will increase the depression. So marriage affect the mental health in two ways. The first one is marriage will decrease the depression for both the man and the woman, and uh, if the couples got divorced, then it will increase the depression. So mainly the effect on mental health can be in two ways. The first one is decrease marriage will reduce the depression, and if the person is divorced, then it increase the depression. Next is the effect on physical health and longevity. Longevity. So people who marry will live longer and enjoy better physical health than those who do not marry. Longer life for those who marry. Longer life for those who may and enjoy physical health. Enjoy physical health. Strong relationship between the physical health, relationship between the marriage and longevity. So the effect on physical health and longevity, marriage If a person got married, then they will give a longer live and enjoy more physical health. And there is a strong relationship between the marriage and longevity also. So if the person does not marry and the person will not enjoy the physical health and their lifespan will be shorter. And if the person has strong relationship, there is also a strong relationship between the marriage and longevity. So this is the effect on physical health. So this is all about the influence of marriage and family on health and health practices. We have discussed about the introduction, health benefits of marriage, positive and negative aspects of the family, and also the illness and family, illness on health behavior, marriage and healthcare uses, effects on mental health, and effects on physical health. In this, we conclude the influence of marriage and family on health and health practices.